physician, so I am here to tackle about the ADHD and autism disorders. So here's the brief introduction of them. Attention Deficit Hyperactivity Disorder, should I say ADHD, and autism spectrum disorders have become more common in the previous decade. According to studies, ASD, while ADHD is defined by impaired functioning in the areas of attention, hyperactivity, and impulsivity, whereas ASD is defined by core social dysfunction and restrictive repetitive behaviors. Studies show that 30 to 50% of people with ASD have ADHD symptoms, especially when they are young, and 2/3 of people with ADHD have ASD features, according to recent research from the Autism Treatment Network or ATN database. Having ADHD and ASD together is linked to a lower IQ. According to recent studies from the Autism Treatment Network or ATN database, having ADHD and ASD together is linked to a lower quality of life and less adaptive functioning than having either of these diseases alone. Attention problems, peer communication issues, impulsivity, and varying degrees of resilience or hyperactivity are common in both disorders. Both are more common in boys than in girls, and both are present at least in part at the preschool age.
Good day everyone, so now I'm going to tackle about the definition and types of ADHD, the Attention Deficit Hyperactive Disorder, and ASD, the Autism Spectrum Disorder, and its characteristics. So ADHD is a neurodevelopmental condition that makes it hard for kids to concentrate, pay attention, sit still, and curb impulsivity. The most common problems in kids with ADHD are defiant and aggressive behavior. This includes refusing to follow directions from parents or teachers. ADHD can also make a person forgetful and distracted, likely to have trouble with time management because of their problems with focus. Also, other children with ADHD have many talents and strengths. This includes creative minds, curiosity, courage, leadership abilities, and having an endless amount of energy. And there are 3 different types of ADHD depending on which type of symptoms are strongest in the individual. These are the predominantly inattentive presentation, predominantly hyperactive impulsive presentation, and combined presentation. The predominantly inattentive presentation is hard for individual to organize or finish tasks, to pay attention to details, or to follow instructions or conversations. The person is also easily distracted or forget details of their daily routines. And the predominantly hyperactive impulsive presentation, it is the person fidget and talks a lot. It is hard for them to sit still for long, for example, as for having a meal or while doing a homework. Children may also jump, run, or climb constantly. Someone who is impulsive may interrupt others a lot of things from people or speak at inappropriate times. It is hard for the person to wait for their turn or to listen directions, and a person with impulsiveness may have more accidents and injuries than others. And lastly, the combined presentation is about having the both symptoms of predominantly inattentive and hyperactive impulsive presentation. And now let's talk about the Autism Spectrum Disorder or ASD. The Autism Spectrum Disorder is a complex developmental condition that involves persistent challenges and social interaction, speech and nonverbal communication, and restricted or repetitive behavior. Autism is usually first diagnosed in childhood with many of the most obvious signs presenting around 2 to 3 years old, but some of children with autism develop normally until toddlerhood when they stop acquiring or love previously gained skills. There are 3 different types of ASD: the autistic disorder, Asperger's syndrome, and pervasive developmental disorder. The autistic disorder, this type of spectrum can also be known as classic autism. Persons having this are usually affected by intellectual disabilities as well. This type is considered the most severe form of autism and also the most common. People who have autistic disorder may have problems with being touched by other people, perform restricted or repetitive behaviors, experience sensory overload, and may have issues of communicating. And Asperger syndrome. This is one of the milder types of autism spectrum disorder. People with Asperger syndrome experience the same symptoms as other types, but they tend to be the milder. Usually, people with Asperger syndrome have unusual behaviors and interests. In addition to social challenges, the symptoms tend to be the most difficult of this type of spectrum, as problems with language or intellectual disability do not tend to affect those with Asperger's. And lastly, the pervasive developmental disorder. And this type of autism spectrum disorder is also known as atypical autism. This type is typically reserved for those who meet some of the criteria for the other two types, but not all of them. Those affected with pervasive developmental further experience milder symptoms or fewer symptoms. They usually suffer from social and communication challenges. And now let's tackle about the characteristics of ADHD and autism. The attention deficit hyperactive disorder is characterized by severe age, inappropriate levels of inattention, hyperactivity, and impulsivity. Inattention is not attentive or not paying attention, for example, making careless mistakes in work or schoolworks, difficulty sustaining attention during a task or when playing, seems not to listen when spoken to directly or doesn't follow through on instructions. And hyperactivity, it means having increased movements, impulsive actions, and a shorter attention span and being easily distracted. And lastly, impulsivity. It is a constant moving, wandering, talking too much, and a person may have trouble sitting still or staying quiet when needed, and they may rush through things that make careless mistakes. And autism spectrum disorder is characterized by poorly developed social skills. It is about having a high level of stress and loneliness in your lives, and difficulty with expressive and receptive communication. It is in which a child struggles to understand and process the messages and information that they receive from others. And lastly, the presence of restrictive and repetitive behaviors. It is about the individuals may engage in stereotype and repetitive movements. For some, it involves saying or talking about the same thing over and over again.
Attention deficit hyperactivity disorder, also known as ADHD, tends to run in families, and in most cases, it is thought that the genes you inherit from your parents are significant factors in developing the condition. Research shows that parents and siblings of a child with ADHD are most likely to have ADHD themselves. There is a 1 in 4 chance for a child with ADHD to have a parent with ADHD. It's also likely that another close family member, like siblings, will also have ADHD. In addition to genetics, scientists are studying other possible causes and risk factors, including brain injury, exposure to environmental risk during pregnancy or at a young age, alcohol and tobacco use during pregnancy, premature delivery, and low birth weight. The etiology of autism spectrum disorder has been a widely debated issue for several decades. However, there is no single known cause of it. Given the disorder's complexity and the fact that symptoms and severity vary, there are most likely multiple causes that may lead to this condition. It has also been said that genetics and environmental factors may both play a role in causing ASD. In genetics factor, autism spectrum disorder appears to be caused by a combination of genes. It can be associated with a genetic disorder such as Rett syndrome in some children. Genetic changes or mutation may also increase the risk of autism spectrum disorder in other children. Other genes may influence brain development or how brain cells communicate, or they may influence the severity of symptoms. Some genetic mutations appear to be inherited, whereas others appear to occur spontaneously. On the other hand, an environmental factor, researchers are currently investigating whether viral infections, medications, and complications during pregnancy or air pollutions play a role in the development of autism spectrum disorder.
This film has been made to help you understand what will happen when you come to meet us. We are a team that meets with children and young people who may be finding it hard to understand how other people think and feel. They may also find it hard to talk about their own thoughts and feelings. When young people feel like this, it can make it harder to get on at school and with friends. So our job is to see if there's an explanation for why you feel this way and if there is advice that can help and support you at home and at school. When we meet you, we will find out about some of the things you are good at, the things that you enjoy doing, the things that might be harder for you, and the things that you would like to be different. You will be asked to come along with your parents or carers. At first, you will all be invited into a room to meet the two clinicians. This is what we call the people that work in our team. Your parents or carers will then be invited into a different room whilst you stay with one of the clinicians. Don't worry, the person meeting with you will just be trying to get to know you a little bit by doing some activities together. They will also ask you some questions about school, friendships and feelings. It is important to remember that there are no right or wrong answers. A lot of the people who come in for appointments might feel a little nervous to start with, but end up telling us that their appointment was fun. Your parents or carers will meet the other clinician. They will be asked a lot of questions, so it is possible that they will take longer than you. When you have both finished, it is time for a break. The two clinicians will meet on their own to talk about your appointment and to also look at information from your school. After the break, there will be another short meeting. Sometimes the clinicians will meet with you together, and other times they may just want to talk to your parents or carers alone. The appointment usually takes a couple of hours from start to finish. It is what we call a one-off appointment, so it is not likely that we will meet with you again. What we will do is write a report that your parents or carers, your school and your GP can have. This will explain about your appointment and what was discussed and give advice about support that may help you at school, with your friendships and with your family. Sometimes we do not have all the information that we need on the day, and we will contact your school to find out more. Thank you for watching our film. If you have any more questions about your appointment, please ask your parents or carers to contact us by phone or on Sharon Jupiter, our online support service. You can also ask us questions when we meet.